study found that nearly 12% of generally healthy individuals undergoing clinical predictive genomic testing had a medically actionable genetic result identified. The most common medically actionable results in our population were related to pseudocholinesterase deficiency, hereditary breast, ovarian, and colorectal cancers, familial hypercholesterolemia, and cardiomyopathy and/or myopathy. Many times, identifying individuals with these genetic variants will alert the patient and their healthcare providers to the increased risk, allowing for initiation of surveillance for early detection or prevention through prophylactic intervention. Hi, my name is Jenny Anderson, and I am a genetic counselor at Mayo Clinic in the Center for Individualized Medicine in Rochester, Minnesota. My colleagues and I wrote an article called Clinically Actionable Findings Derived from Predictive Genomic Testing Offered in a Medical Practice Setting. This article will appear in the June 2021 issue of Mayo Clinic Proceedings. Historically, genetic testing for adult onset diseases was reserved for individuals with a personal or family history that was concerning for a hereditary disorder. This testing often consisted of analyzing single genes one at a time. The development of next-generation sequencing changed the application of genetic testing, allowing more rapid and inexpensive genetic testing to be performed on a large number of genes all at once. Genetic testing is now an integral part of medical care for many common conditions like cancer and certain cardiovascular conditions. Given this new technology and increase in genetic testing utilization, genetic testing for proactive or preventative purposes has been proposed. This type of testing involves screening generally healthy individuals with no suspected genetic conditions to better understand their potential for disease risk. This type of testing is commonly termed predictive genomic testing or screening. In 2014, leadership from the Mayo Clinic Center for Individualized Medicine developed one of the first clinics in the US for predictive genomic services for generally healthy asymptomatic adults through the Mayo Clinic Executive Health Program. Interested patients self-selected a predictive genomics appointment as part of their Executive Health Program visit. Patients met with a genomics nurse and genetic counselor to discuss their health, family history, and predictive genomic testing options. Patients were presented various testing options based on what was available at the time of their appointment. 3 testing platforms were offered during the duration of this study: 2 genome sequencing options in which a patient's entire genome could be sequenced, as well as 1 gene panel option in which a pre-selected number of genes were analyzed. The patients chose which test they wanted to pursue, if any, through a shared decision-making model with the genetic counselor. Patients who elected testing were offered post-test genetic counseling to discuss results, and then appropriate information was provided back to the patient's physician in the Executive Health Program. Associated costs were paid out of pocket by the patient. In this present study, we conducted a retrospective medical record review of patients seen in the Predictive Genomics Clinic to determine the characteristics of patients who elected or declined screening, the nature of their genetic test results, and whether actionable results would have been expected based on personal or family histories. To our knowledge, this is the first report of predictive genomic services offered in a clinical, non-research setting. Between 2014 and 2019, 1,281 patients were seen for a predictive genomics appointment. Following pre-test genetic counseling, 23.5% or 301 patients elected predictive testing. Uptake rates of testing increased from about 11% in 2014 up to nearly 40% in 2019. Of the patients who elected testing, nearly 12% had at least one clinically actionable result identified. The most common clinically actionable results were related to pseudocholinesterase deficiency carrier status, in which individuals who are carriers have an increased risk for certain adverse anesthesia reactions, hereditary cancer predispositions, in which individuals have an increased risk for certain cancer types, such as breast, ovarian, and colorectal, familial hypercholesterolemia, in which individuals have a risk for significantly elevated cholesterol levels, and cardiomyopathy and myopathy, in which individuals have an increased risk to develop one or both conditions depending on the genetic variant. Interestingly, about 50% of individuals who are identified to have a hereditary cancer risk or hereditary cardiovascular risk did not have a personal or family history that was highly suggestive of those conditions. This means that about half of individuals with a medically important result would have been missed if we were only offering genetic testing to those with a strong personal or family history of disease. Our predictive genomic tests also assess genetic variants beyond those deemed clinically actionable, such as carrier status for autosomal recessive conditions and risk alleles in which the risk for developing a common multifactorial disease was slightly increased. About 54% of our patients were found to be a carrier for at least one recessive condition. Learning about carrier status can be important for reproductive purposes. About 45% of our patients were found to have at least one risk allele for a multifactorial condition, such as a blood clotting disorder, non-alcoholic fatty liver disease, or Alzheimer's disease. It has been proposed that learning about risk for multifactorial conditions may influence positive lifestyle changes to reduce said risk. As our study has shown, there is a significant positive rate of actionable genetic findings in the generally healthy population. Predictive genomic testing has the ability to identify genetic risk when family history falls short. Utilizing large genomic testing platforms in the healthy population requires the appropriate resources for managing these patients and their family members, both pre-test and post-test. As more patients inevitably elect predictive genomic testing, and for such testing to work effectively, it is critical that results are utilized appropriately and responsibly in the larger healthcare system. Our findings from the first report of predictive genomic services offered in a clinical setting suggest that wider knowledge and adoption of predictive genomic services could be beneficial in routine medical practice, particularly when utilized before the development of disease. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.